new variant is highly concerning because it is yet more transmissible.
The utterances made on South Africa's COVID-19 variant by Matt Hancock, the United Kingdom's Secretary for Health, has left a bitter taste in the mouths of some political parties in the country, including Health Minister Dr. Zweli Mkhize. In a statement released on Thursday evening, Mkhize lashed out at Hancock, further adding that some of his utterances have created a perception that the variant in South Africa has been a major factor in the UK's second wave.
However, it's important to note that the new variant that has been found in South Africa is not in any way contributed, as Dr. Zweli Mkhize and his team have confirmed, has not contributed necessarily to any country's second wave.
We must caution the United Kingdom against creating a stigma about the virus mutation emanating from an African nation. Already, we have seen the racism of the United States of America, which has led to the negative conception of China as the cause of the pandemic, while the virus has ravaged European nations and the United States the most. It is of no use to make isolated travel bans on nations, as if the behavioral patterns of the virus can be confined to one nation.
The UK wants to use South Africa as a scapegoat. The UK always had higher COVID-19 infections. This is totally unacceptable that South Africa must be used as a scapegoat. This is a global problem. All of us must stand together to find a solution to this problem.
The ban is an overkill, and it is not fair for the UK to do this soon after the Brexit deal that they've struck with the European Union.
The United Kingdom has since imposed a travel ban between the two countries.
In a matter of days or weeks, it's important for us for there to be travel between the UK and South Africa. But this is simply a temporary measure to allow our scientists to investigate this variant of the virus further. We want to sort of understand it. We want to understand the risks around it. As the Foreign Secretary has said, the virus is very transmissible, and we've seen that, of course, in what South African experts have said. But there are also additional mutations in the South African variant compared to the variant that is currently in the UK at the moment. And it's those additional mutations that our scientists want to investigate.
Although one expert suggests that this will not have a negative impact on relations between South Africa and the United Kingdom, it is important to base all decisions made on scientific evidence.
It was through the work of South African scientists that actually made it possible for the UK and even other countries to pick up this new strain of COVID-19. But it's also important to acknowledge the fact that South African scientists have said there is no evidence at the moment that actually shows that the strain that has been detected is actually more dangerous than the one that was detected in the UK. And that likely informs the current decision by South Africa to not restrict travel, inward travel from the UK into South Africa. Of course, this may change with time, but I think what's important is that South Africa has kept to what it's been doing, which is generally to allow policy to be informed by scientific analysis.
South African scientists are working around the clock to fully understand this new COVID variant and the threat it poses on the lives of people. Meanwhile, Al Jamaa has written to the British Embassy requesting them to lift the travel ban. Natasha Piri, SABC News, Johannesburg.